Episode 3 Chronic Inflammation, the hidden fire inside your body. Welcome back to the Silent Killers. I am Dr. Chaitanya, an internal medicine specialist from Hyderabad. And in today's episode, we are going to talk about something might be silently sabotaging your health. Chronic inflammation. We've all heard of inflammation, maybe in the context of a sore throat, a sprained ankle, or an infection. That's called acute inflammation. And it's a good thing. Your body, natural healing response. But what happens when the inflammation doesn't turn on? What if your immune system keeps firing even when there's no clear injury or infection? That's chronic inflammation. And it's now recognized as a root cause of many modern diseases, including diabetes, heart disease, arthritis, autoimmune conditions, Alzheimer's, and even cancer. So what is chronic inflammation really? Think of it like this. Your immune system is like a security team. Acute inflammation is like responding to a break-in, quick targeted effect. But chronic inflammation is like that security team constantly patrolling, constantly attacking, even when there's no threat. So eventually causing wearing down and issues and in chronic diseases in the body. So what causes this hidden fire within us? The biggest triggers are lifestyle related. Poor diet, too much sugar, too much refined carbs, seed oil, processed meats, sedentary lifestyle, sitting for long hours without movement, sleep deprivation if you are getting less than 6 hours, chronic stress, work pressure, emotional trauma, burnout, toxins from plastic, pollution, personal care product, unresolved infections or gut imbalance. Even being slightly overweight, especially with belly fat, is a major source of inflammation. Fat tissue releases inflammatory chemicals called cytokines, which keep your body in a low-grade immune response mode. How do you know if you have chronic inflammation? It often hides under vague symptoms like constant fatigue, joint pains, body pain, brain fog, bloating, digestive issues, skin conditions like eczema or acne, mood swings or depression can occur. Elevated CRP or ESR in your blood test indicate chronic inflammation. These might seem unrelated, but they're often driven by the same root, inflammation. So the good news, chronic inflammation is reversible and you don't need medications to start healing. It begins with small daily change. My top 6 anti-inflammatory lifestyle tools. First is an anti-inflammatory diet. Vegetables, fruits, turmeric, ginger, fish, nuts and seeds help. Cut sugar and cut seed oils. These are the biggest culprits to trigger chronic inflammation. Daily movement. A brisk 30-minute walk lowers inflammation. Sleep like it's medicine. 8 hours of quality sleep reduces your stress hormone cortisol and resets your immune function. Mind-body practices, meditation, yoga, deep breathing exercise can reduce stress. Fix your gut. Fermented foods like curd, buttermilk help. Avoid unnecessary antibiotics. So patient story from Hyderabad. A 28-year-old IT professional from Hyderabad came to me with fatigue, joint pain, bloating, no major diseases, just feeling off. CRP was high, gut markers were off, and his diet was full of chocolates and colas and chips. We shifted him to a clean diet, added probiotics, cut sugars, cola and chips, asked him to sleep better. Today he has no pain, better energy, no stress, and he feels good, and the inflammation is down. Don't ignore the signs your body gives you, even if your reports look normal. Chronic inflammation is like a slow burning fire, and if left unchecked, it can burn through your health. You can reverse it, but it starts with awareness and action. If you found value in this episode, share it with someone who's always tired, battling unexplained symptoms. You might actually just help them get back their life. This is Dr. Chaitanya, and you've been listening to The Silent Killers. See you in the next episode.